Welcome into another episode of Everything is Logistics, a podcast for the thinkers in freight. I'm your host, Blythe Brumleve. I'm happy to welcome in Matt Bolden, Director of Product Marketing over at Kinsa, and we are going to be talking about how health analytics can help brands and retailers optimize supply chains. So, welcome in, Matt, to the show.
Thank you, Blythe. It's great to be here.
Awesome. So now this interview is coming at a perfect time because or not, I don't know if perfect time is the right way to phrase this, but I experienced my first stomach flu bug yesterday and it's
Uh-oh.
lingering effects today. So I am highly caffeinated right now and trying to get through this illness. And that's what we're going to be talking about today is how people can, basically or how brands and businesses can basically optimize their supply chains in order to combat different illnesses that are popping up all around the country. So, for folks who might not know about what Kinsa does, can you give us that sort of high level Eagle overview?
Yeah, absolutely. So, kind of like you've just started to highlight, illness, especially infectious illness, is very unpredictable. It's highly volatile. So, that's over time and geography. So, think year to year, season to season, even month to month or week to week. It's volatile, it's unpredictable, it's shifting as to where and when it's having the most impact. So that's true for, cough, cold, stomach flu, like you just experienced. It's also true for illnesses like allergies. So this makes it really challenging for the brands and retailers who sell symptom relief products to forecast how much demand for their products there's going to be, how much product they're going to need to produce, and then where and when it's going to be needed the most. So that's where Kinsa comes in. So at Kinsa, we have the unique ability to predict where and when illness symptoms will spike purchase demand for highly volatile categories like cough, cold, flu, allergies, disinfectants, and other illness related categories. So at Kinsa, basically we do three things. We help retailers, consumer packaged goods companies, think medicine brands like Mucinex, Johnson& and Johnson, brands like that, and pharma companies do three things. We help them target their marketing where and when people need illness products. And I think a little bit more relevant to our conversation today, we help them reduce out of stocks where and when illness driven demand is going to surge. And we help them plan more effectively and reduce risk. So that's things like financial planning, production planning, and just overall risk management.
And so, give us, I guess, sort of a high level view of what the current healthcare supply chain looks like, because this all sounds, very data driven, and from what I understand, Kinsa is pretty much a data company that is providing collecting these kind of insights and then providing them to retailers and brands. And so, what does, I guess, sort of the current healthcare supply chain look like, and then where does Kinsa fit in?
Yeah, that's a great question. So I would amend that slightly, Blythe, and say that we're an insights company. We're a data insights company. We do have this unique data source that we're combining with other data sources to produce our insights. But we do have SaaS platforms that we're producing and that we partner on our customers that we partner on with our customers to use. So as far as the healthcare product supply chain, which is what I can speak to today, think like illness products. So that's symptom relief products like, cough drops or cold flu medications, things like that. That's things like disinfectants, wipes, those kinds of things. If we look at the past few years, basically ever since COVID, we've really, just to kind of go back to what I said in the beginning, we've just seen a ton of volatility, kind of a push and pull on the supply chain. So if we go back to 2020, think about February, March of 2020, the pandemic's first starting. There's a lot of panic buying going on. There's a lot of stocking up on things like disinfectant wipes, medications, any products really related to illness. So what we're seeing there is we're seeing out of stocks quickly across the country. That wasn't just toilet paper. That was especially illness related products actually as well. And that what we saw after that is due to kind of societal response to COVID, remember shutdowns, people not socializing as much, work from home becoming pervasive, school shutting down. What we saw was that illness levels as a whole, think about flu, colds, those kinds of things that are usually transmitting with all that intermingling, um, absolutely dropped. Just dropped. We had a very flat overall illness season for the rest of that year into 2020, 21, because people weren't socializing as much. There wasn't as much opportunity for illness to spread. So what we saw then was the panic buying switched into there's a lack of need-based purchasing. So we go from an understock dynamic where we were seeing out of stocks, at the beginning of the pandemic, to now we're seeing overstocks. We're seeing, all these orders are popping up from brands and retailers to try to meet demand from customers early on in the pandemic. That need-based demand ebbs and eventually kind of disappears. So now we're seeing overstocks. Then we get into illness season again, into the illness season in November, December, January, February of 2020 and 2021. And then we see demand spike back up. So now we're in the opposite environment with a supply chain crisis that we're seeing with just the supply chain across the board, not just illness products, but across the board. Now we're back to this environment of out of stocks. So it's just kind of this ebb and flow where we've seen out of stocks, overstocks, out of stocks again. And then ever since the 2021 season, we're largely seeing issues with out of stocks, with brands and retailers not being able to meet demand because of the supply chain, for lack of a better word, the supply chain craziness that we've seen since the onset of the pandemic.
And so it's a lot of this, it's just very difficult to predict, but I would imagine that that's where Kinsa comes into play with a lot of your different offerings and insights, as you said. But then there is also this one really cool thing that I was watching on one of your interviews, or not you, but Kinsa in particular, and it was the smart thermometers. Can you give us a breakdown of how the smart thermometers and how that concept works within Kinsa?
Sure. So the smart thermometers are a part of that unique data source that I mentioned earlier. They're a part of the mechanism for capturing this missing ingredient data source. And so let me open it up or kind of draw back a bit and say that really at the end of the day, what we're trying to do is we're trying to help, with this backdrop we just talked about, we're trying to help our customers, illness product brands and the retailers that sell those brands to get out of a reactive mode and do a better job of forecasting, to get ahead of demand and build the right amount of product. And then, of course, get it to the right place where it's needed the most. So how do we do that? Well, basically what we found was that available illness data sources to try to predict how much illness-based demand there was going to be were totally insufficient. They were lagged, they were incomprehensive, they were frankly just not accurate. So what we set out to do, starting about 10 years ago actually at Kinsa, was we sought out to collect that missing ingredient data. And that missing ingredient data is real-time household level data collected at symptom onset. So today what we're doing is we're aggregating data from more than 30 sources, healthcare data sources, lab data sources, but we collect that missing ingredient data source from a proprietary network of millions of users to accurately detect and forecast spreading infectious illness. So to do this, to capture this hyperlocal illness data before or if someone never visits a doctor in the first place, we invented a new category of products, the smart thermometers you just talked about. So those smart thermometers, which we introduced about 10 years ago, along with our medical guidance app, which we refer to as a nurse in your pocket, it's literally giving you medical guidance for you and your family as to how to deal with symptoms, what treatment options you should pursue, when to call a doctor, that kind of thing, as well as email and text alerts. This is that missing ingredient data set that has allowed us to communicate with households at symptom onset and to be able to accurately predict illness spread before it happens.
And so what does the data collection process look like? Because for a lot of folks, for me in particular, as soon as I got sick yesterday, it was one of those things where it just came on so quickly. Then a few hours later, I started getting a fever. I have a regular thermometer at the house, but if I would have even thought about the fact that I could get a smart thermometer to be able to properly diagnose, I didn't even find out exactly what I had until this morning. So what does the data collection process look like? Is it more of, getting the thermometers in as many hands as possible and spreading brand awareness? Is it as simple as that?
So we've built our smart thermometer business over the years to the point where we do have this network of 2.5 million households. And so a lot of that's just been through retail sales. We've come to make up about 90% of the smart thermometer market over the years. We've also distributed thermometers through Title IX through Title I schools. We've built up distribution networks to try to get our thermometers in as many hands as possible, in order to make sure that we're getting, a great representative sample of the United States, of our population, to see, where, when illness is spreading. And so kind of what you just talked about with your recent illness is a lot of the conceit of how we're able to capture this illness data that other folks just aren't able to. As soon as you fall sick, what's one of the first things you do? I think, as you said, you're going to reach for a thermometer and take your temperature, right? So that's what we realized is that's the opportunity to get the very first sign of symptoms. Is if we can capture, if we can, enter somebody's illness journey, if we can be a part of somebody's illness journey, as soon as they're getting sick, that's how we're going to get the first sign of illness and then see where it's going to be able to predict where it's going to spread next. So after the smart thermometer, that's where we started with the medical guidance app. Now, the medical guidance app is where we're collecting, so much more than fever data, but this is where we're interacting, we're able to communicate with households, and we're able to give them advice on a number of symptoms. So it's way beyond fever. It's, it's cough symptoms, it's earache, it's headache, it's even things like stomach ache or diarrhea, GI symptoms, runny nose, stuffy nose. So we've been able to build up such an engaged user base with this app. We're actually getting 92% response rates on our symptom follow-up questions that we're able to forecast. We're able to forecast illness symptoms way beyond the scope of fever to cough, cold, flu, allergies, etc.
And so with what makes that thermometer smart? Is it just is it, I don't want to say only taking your temperature, is it measuring anything else? Like I didn't even know that there was such a thing as a smart thermometer. Can you kind of give us a layman's terms of what it is measuring and how?
Sure. The thing that makes it a smart thermometer is the fact that it's a connected thermometer. The fact that it's connected to this application where you're able to get this real-time medical guidance. You're able to log your symptoms. So you're able to see, for example, if you're a parent, you're able to track the symptoms of your child, and you're able to see, okay, I have a fever increase here, I have a symptom onset here, starting to develop a headache here. And so using this log, you'll be able to get better care, for your child, taking that data to your provider, to your primary care physician, for example. So this is what really elevates our smart thermometer over, a traditional thermometer.
And so what happens after, so if I have the thermometer, I get diagnosed, I have the symptoms, I kind of know a general idea of what I have and how to treat it. What happens after the fact of, the data collection or the data reporting? What happens on Kinsa's side of things once, certain, I guess, readings have been added to the system?
Sure. So transitioning from sort of the consumer side of Kinsa, where we're interacting with folks, with sick individuals, helping them to feel better, and transitioning into Kinsa Insights, which is our health analytics side of the business. What we're doing once we have this data, first of all, it's all aggregated and anonymized, 100% aggregated and anonymized. There's no personal data whatsoever that is used in any of our models. But what we're doing is we're able to apply ML to this data to then be able to forecast where and when we're seeing surges in specific symptoms or specific category illnesses. So if for example, we have, X number of users in Atlanta, Georgia, and we're seeing a surge there, we're going to take note of that. And that's something that's going to show up in our SaaS products that is going to alert a brand or retailer that, hey, we're seeing a surge in, for example, cough. This is where you might be expecting more demand for your cough products. This is where you might want to allocate more products. This is where you might want to do more marketing. This is where you might want to, target promotions. So there's a lot of different business outcomes or business levers that can be pulled based on this illness, because at the end of the day, it's really illness that drives demand for illness-related products. It's a need-based product.
And so when with respect to the brands and the retailers that you're working with, I know that you just had a press release about Zyrtec and your partnership with them. What kind of use cases or examples that you can give us from a brand using the insights from Kinsa and how they're able to apply that to their own supply chain?
Yeah, absolutely. So we've got a few different solutions, and I'm glad you mentioned Zyrtec. I'm so excited to partner with Zyrtec. And Zyrtec in particular is going to be using our Forecast Advisor solution. So this is about getting ahead of illness and forecasting illness and therefore illness-based need ahead of the season. So if you think about cold, cough, and flu, that's ahead of the cold, cough, and flu season. So think like November, what's going to be happening in January. But with allergy, you really have two allergy seasons. It's sort of like this double humped model over the course of the year. You've got a spring allergy season, which is a little bit more intense, and you've got a fall allergy season that's slightly less intense, but tell that to somebody who's suffering from fall allergies. So what they're going to be doing is they're using our Forecast Advisor product to predict the level of allergy medicine needed to fulfill demand. So that's going to help their planning teams to better prepare for and respond to this upcoming spring allergy season and then the fall allergy season after that. So basically what we're doing is we're helping them to predict and get ahead of the right level of need-based demand based on prevalence of allergy symptoms.
And then based on the insights and the forecasting that you're able to give them, especially when it comes to the insights and maybe, stock wise, and if things are going to be running out soon, what kind of response time does it look like for these brands to be able to just flip the switch and be able to position their marketing and position their products into areas that it needs? I mean, this might probably be a question more for like each brand specifically, or they probably each have their own response time, but is it I would imagine it's much more quicker for them to be able to make these kinds of decisions, and efficient decisions is probably where Kinsa comes into play. Is that a safe assumption?
Actually, it's kind of it's really the full gamut of timeline. It really depends on the use case at the end of the day. So if we think about from the longest lead use cases, especially with like this forecast advisor solution we were just talking about, we're looking at long lead forecasting. So we're looking at things like influencing overall production. How
Hmm.
much medication are you going to produce? Something with like an 8 to 12 week lead time. And given how long of a lead our forecast is, that's something that we're able to help them do. Are we going to influence production up or down? Another thing is financial planning. What are our overall financial goals for the quarter, for the month? What's a reasonable sales goal? That's going to be based on illness-based need, right? So we're going to give them we're going to help them to develop the best and most accurate forecast for what their financial projections should be. If we start moving a little bit into the season, we're getting a little bit tighter in time frame, then that's where we start looking into more like of a dynamic response in terms of supply chain. So that's where we pivot to more of our retail sell-in product, which is a product that helps brands know where and when illness is going to surge and where and when their illness correlated products, again, by symptom, are going to be most in demand. So what it does, it allows brands to say, okay, with a 4 to 6 week lead time, that's the time frame we're operating in with our retail sell-in product. Distribution center Y in this area of the country, say the southwest portion of the country, we're going to see a really a large surge in cough symptoms or nasal symptoms, for example. So if you're at a brand that's selling cough medicine, that's positioning nasal medication, you'll be able to say to your retailers, like, hey, we're seeing that in 4 to 6 weeks, we're going to be getting this surge and demand. You guys really need to move some more product into this distribution center in the Southwest. We're going to have more demand in the Southwest, less demand in the Pacific Northwest. You're able to dynamically respond. You're able to pull that lever to move product from one area to the other. And it's the same dynamic with retailers with our inventory optimization solution. We're getting even tighter in time frame, whether the 7 to 14 day lead time. What they're able to do is they're able to dynamically adjust safety stock even on a store level. So they're able to say, okay, we can move a little bit more stock from this area, from this store to this store on the other side of town or on the other side of the state, so that we can meet demand where there's going to be more demand for our products. So it's really from all the way, from months in advance to as dynamic of a response as a 1 to 2 week lead time.
And that's 1 to 2 weeks, or even 4 to 6 weeks could mean the success or the failure of a lot of people getting sick or not getting sick. And it's kind of comparative to like the CDC, for example, where they're reporting on data that is maybe 4 to 6 weeks old, where you're
Hmm.
predicting where in advance of where some of these trends are going. And I was watching one of the interviews with a CEO about a year ago that said the CDC wouldn't collaborate with the private sector in order to communicate pockets of infection. That was a year ago. Has the CDC sort of changed their tune on some of these predictive analytics and working with the private sector, or are they still kind of, as government entities do, kind of stuck in their old ways?
Unfortunately, I would say what we're seeing is more the latter.
Hmm.
We're seeing private organizations. We're working with private organizations ourselves without the influence of public organizations, I guess is the best way to put it, without the influence of the public sector. But to your point, though, that is where this unique data stream that we have access to, our proprietary data we're getting at the house from these households, at symptom onset, that's real time, and
Hmm.
that's the real time signal, that's the real time data that we're piping to our customers, as opposed to, like you said, it's unfortunate, but the data that the CDC is relying on, it's already weeks old, and it's incomprehensive because it's only coming from folks who have entered the healthcare system. So fewer than 50% of folks who get the flu ever see a doctor, ever see a primary
Very
care
true.
physician, ever even, log on to Teledoc and see a provider that way. So then we start thinking about colds, RSV, other less severe illnesses, that number drops. So you're seeing an even smaller percentage of the folks that are actually suffering from illness. And so that's where Kinsa is unique, is that we get this full picture of illness in real time as symptoms are happening.
And one of the unique programs that I think you had mentioned earlier, and I also heard it in that same interview, is that you partner with a lot of different schools to give them these free smart thermometers. And I know for a fact that where I got my sickness from was my best friend who has a kid in school, and she's a teacher, and so I know it was probably from kids. And so I would imagine that the school system is really where a lot of this data can come into play and educate the entire community. Is that a safe assumption that maybe a lot of these illnesses are first being reported within the schools because of all the kids and germs and things that are inside of a school, and then it kind of permeates throughout the community?
That is generally true. A lot of illnesses are their vector. They're starting in schools. They're starting with children. Let's put it that way. They're starting with the pediatric population. They come home. They bring it to the family, et cetera. That dynamic does change, though, as diseases change. That's another thing that's
Hmm.
kind of changed over time with the advent, with the pandemic, with the start of the pandemic, is that we've seen this dynamic of child to adult, and adult to child has kind of flipped back and forth a little bit depending on what the
Oh,
dominant
interesting.
strain is, whether it's flu that's more influencing illness or whether it's COVID that's more influencing illness, and then societal factors as well, social factors like are schools in session or are they closed? Are folks working from home? Are things shut down or are we open? And so that's something that's changed a little bit over time. But as we move back to a little bit of a more normal, a little bit more of more normalcy in terms of our response to illness, um, I would say it's safe to say that we do see a large amount of transmission starting with children, whether that's in the school or whether that's at home. And again, our smart thermometer product, as well as our medical guidance app, is really helping us to get ahead of illness with pediatrics, especially, although we do, of course, have many users that are adults as well.
And so this feels like such a smart solution, a smart common sense solution to be able to effectively provide the medication where it's needed most. I'm curious as to sort of the competitive landscape. Is Kinsa really the only company that's providing these solutions, or are you the market leader in that regard?
I would say we're certainly the market leader. There are some other solutions out there that are relying on traditional healthcare-based data set,
Hmm.
claims-based data sets to provide illness forecasting, but there's nobody else that has this real-time illness data set that's taken from households at symptom onset. Um, to what I like to say is that we're doing a little bit of category creation here. We kind of created the smart thermometer category, and now what we're doing is we're kind of elbowing into creating our own health analytics category as well.
And so last couple questions for you. If I could give you a magic wand to fix the healthcare supply chain, especially when it comes with respect to medication, what would you want to fix, or what maybe is in the pipeline that Kinsa is developing for the future?
I think the main thing would be to I think the main thing would be to be able to, like I said in the beginning, get out of reactive mode and get proactive. So that's
Hmm.
being able to make these decisions as far as production and allocation ahead of demand. And so how are they doing that? They're accurately forecasting illness-based need before it happens, and then integrating this data into their supply chain, into their production, into their demand planning. So what I would say is that the data is there, the insights are there now. Kinsa's producing them. I think it's just a matter of actionability and kind of expanding the use case of those insights that we're providing.
Awesome. Yeah, this was a great conversation. So where, if folks want to get a smart thermometer, if folks want to see more or learn more about the insights and the forecasting that Kinsa provides, where can they get more information and even purchase a smart thermometer?
So if you want to learn more about Kinsa Insights, I would steer you to kinsainsights.com. We've got a lot of great content on there, including case studies and profiles of some of our work with organizations like customers like Mucinex, customers like Zyrtec. We just talked about Johnson & Johnson Consumer Health. And if folks want to become a user of Kinsa, if you want to pick up a smart thermometer, we're at major retailers across the country and Amazon. So I would say your local drugstore will carry a Kinsa smart thermometer, or you can always pick one up online.
Awesome. Well, thank you so much, Matt. That this was a great, fascinating conversation, and it's cool to know that these kind of solutions exist. And even though I'm sort of past, where I would use it for my sickness, I can at least know that in the future that I can have something to rely on. So appreciate your time, and thank you again.
Absolutely. Thank you, Blythe.